know why we have gathered here. We have just gathered here to know some preventive measures for the early detection of breast cancer, like some tips or few tricks which you can yourself see at home for yourself and be aware. So today, as of a speaker, we have Dr. Indrani Roy with us. She is a practicing gynecologist in Shillong who is dedicated to work for women's health. She is a fellow of Indian College of Obstetrics and Gynecology. She is working for the upliftment of women's health by spreading breast and cervical cancer awareness in women. She also works actively for educating adolescent girls, and she conducts several awareness camps on menstrual hygiene. She has also been organizing academic conferences for education and awareness. She was also the past president of Shillong Obstetrics and Gynae Society, East Zone Coordinator of Breast Committee Federation of Obstetrics and Gynecological Society of India. Wow, what a profile, ma'am. We are so humbled and grateful to have you here with us. So, welcome, ma'am, and thank you so much for joining us and today spreading this awareness and educating all the females of CVMD we have today with us here. Thank you so much, ma'am. Now, I would like to hand you over the mic so you can share your thoughts and you can conduct the session.
Thank you so much, Ria, for those kind, sweet words, which you have, I think you were really over exaggerating, nothing as such. I'm just trying to work some little bit of awareness for women. As ladies, we think that we all work together for this main intention of ours. So thank you, Rachna, and your CVMD team for this opportunity today. And this is a part of International Women's Day celebration. So at the outset, I would like to wish all of you present here a very happy Women's Day. So, as you're aware, tomorrow is International Women's Day, and the theme for this year, International Women's Day, is Choose to Challenge. So, this states that the women are responsible for their own thoughts and actions every day, and they challenge the world every day. And the theme further signifies that women can choose to challenge gender bias and inequality in this world. So, this year, we are going to choose to challenge and change ourselves so that we are more aware of certain diseases which we might get so that we can prevent it. So a challenged world is an alert world. We can all choose to challenge. We can choose to seek out and celebrate each other's achievements. Collectively, we can all help to create an inclusive world. So from challenge comes change. So let's all choose to challenge. Today, we are going to make one pledge that we are going to get ourselves aware of this breast cancer, which is one of the killer diseases in our country. So I'll be talking on basically breast cancer awareness. And as you all know, for that matter, any cancer, early detection is the most important cornerstone which will save lives. Regarding the statistics, if you see, it's so alarming statistics. Then small breast, many of us, we think if our breasts are small, then we have a less chance of getting cancer. There is no relation between the size of the breast and your risk of getting cancer. It is same in all women. Breast cancer always comes in a form of a lump. That's entirely a myth. No, if you feel some swelling, then only I will go to the doctor. No, it might be definitely lump or swelling is a sign of breast cancer, but you must be aware of other changes which are there present in your breast, which might be very early signs of breast cancer too. Then regarding drinking coffee, many of us think that if we are into coffee, you might be having a higher risk. But in evidence shows that in reality there is no causal connection between excess coffee intake and breast cancer. And then there's again a myth, mammography. If you are what we are advising, like if you are going for mammograms, mammogram is a test which exposes your body to radiation. So if you think that if you go for mammogram, I'll be exposed to radiation, so my chances of cancers are increased. But in reality, the mammography, the amount of radiation exposed is so minuscule. So the benefits are far more better than the risk associated with those radiation. So coming to the risk factors, what are the risk factors? As females, we all know we have this hormone estrogen. So this estrogen imbalance is one of the important factors. The fat cells are estrogen making machines leading to estrogen imbalance. So one more important thing is that we have to see that whether we are not on the overweight side. Then of course, genetic. If you have some family history, definitely you are at risk, and there's some certain genetic factors which might predispose you to breast cancer. And then the environmental factors like diet, exposure to toxin, pollutants. These are, for that matter, for any cancer, this puts you into the risk category. So what is the best defense we have in our quest to fight against cancer is to maintain a very healthy body weight. Now, we all know about Angelina Jolie, right? She had undergone double mastectomy with a prophylactic oophorectomy because her chances of breast cancer were very high. So she had a particular gene, genetic BRCA1 gene, which had put her into risk for breast cancer. Anytime something like this comes, a celebrity putting on her, this has a lot of influence in influencing people. So they get aware, this celebrity effect, that they'll go and find out, okay, what's happening? Let's see, even if I have that gene and all, so maybe I'm also at higher risk. But actually, newer evidence suggests that even if you have this faulty gene, which Jolie had actually, this gene will require certain modification, certain silencing or modification before which the cancer will progress. So then certain changes are required in the genes. So that doesn't mean that everybody should go and test for this BRCA1 gene, whether I have. So if you are having a BRCA gene and you are already having breast cancer, then it is mandated that you check for the gene, so that will help in your management. And who has a very high risk. So if you should understand the balance which is required, what is required. Then coming to, all of us know, vitamin D, the rich sources of vitamin D I've highlighted here: milk and milk products, fish, eggs, it plays a very important role in women for all cancers. But the evidence shows that risk of breast cancer is cut into 50% if you have adequate levels of vitamin D. So you should check whenever you are going to a doctor. If you check your vitamin D levels, and if they are low, please supplement yourself. Medicines are available to supplement vitamin D. So this nutrition, it is important not only as adults, from the growing stage, even when the baby is inside the mother's womb in uterus and in the puberty, her nutrition plays a very important part in influencing the gene which Jolie had, that BRCA1 gene. So it is very important, the nutrition in the pregnant ladies and in the adolescent period of the girls. So intake of fruits and vegetables are must, which will lower your risk of breast cancer. Now, coming to the screening methods, I'll just explain in details regarding this, what you can do at home before you visit a doctor. So what are the things which are available? No, most important is a self-breast examination or a breast self-examination, which we call BSE. Then we have a clinical breast examination. This is done by the doctor. You go to a doctor who will examine your breast. And then the other investigations, which is a mammogram and an ultrasonography. So these are the 4 things which we have in our hand. So next comes, when should we start screening? When do we start to screen? Between 20 to 30 years, it's mandated that every 3 years you get a breast examination done by a doctor. That is called a clinical breast examination. After 40 years, you should go for this examination every year, once a year. And mammography also starts annually. It's a screening method. It starts as early as 35 years of age. But coming to the most important thing, self breast examination, which you will do at your home yourself. Every month, you're supposed to do that, everyone who's above 20 years of age. That self breast examination. I'll come into details of this. So, when is the correct time, like how to do it and all. So even if you are at no risk, you have no risk of cancer in your family, no risk of breast cancer, but it's always very aware that you stay aware of what is happening to your own body. So it is the checkup which a woman does every month at home. So when is the time, ideal time when you should do it? It is best time to do it is just 3 to 5 days after your period starts. Why after the periods? Because pre-periods, your breasts are actually lumpy feeling and tenderness there. So you might get some false positive results. So it's always after your period starts, you do a self-breast examination. And those who have gone through menopause already, you're not having your menses anymore, you can do the examination on the same day of every month. So what is the biggest barrier? Why we women, as women, we are failing in this barrier? The biggest barrier is that we don't have confidence. We think that we cannot do the self-breast examination. So I'm sure many of us will not do it, which is recommended once a month. So what are the basic steps? Huh? So first thing is like, looking in front of a mirror by inspecting. And the next one is with your hand, palpation with your hand, which can be done either in the lying position or in the standing or sitting position. So in front of a mirror, you have to stand facing the mirror with your arms relaxed at your sides or your arms resting on your hips. These are the two methods how you stand in front of the mirror. Then you turn to the right and left for a side view and look for any flattening in the side view. You can see the picture. Then you have to bend forward from the waist with your arms raised overhead. Stand straight with the arms raised overhead and move the arms slowly up and down at the sides. You can look for the free movement of the breast over the chest wall. Press your arm firmly together at the chin level while the elbows are raised to the shoulder level as shown in the picture. Then coming the lying down position. So you have to place a pillow under your right shoulder and place the right hand behind your head. This position distributes the breast tissues more evenly. You can see the picture. And then you use your 3 fingers, the middle 3 fingers of your left hand to feel the lumps. Okay. So you have to press the breast tissue against the chest wall firmly enough to know how the breast feels. You see the diagram, you'll understand. So use circular motions, all around. You have to go through all over the breast, all the quadrants, like in a circumferential manner. Like clockwise, you go through the entire breast, like this. You just press all over the breast. Then you bring your arm down to your side and feel under your armpit, because the breast tissues are also located under the armpit. It's very important to find anything there. Then similarly, you have to repeat the examination on your left breast using the opposite hand, right? Now standing or sitting position also, you have to palpate. Repeat this examination of both breasts while upright with one hand, arm behind your head. So you can see the picture, you'll understand. This position to check the upper part when you were standing or sitting position. So this can be done in the shower. So in the shower, you're they hide more easily, so it's more easy. Movements are more comfortable if you can do it under the shower. So what are things which you look for? Whether your breasts are symmetrical, full, rounded, smooth in all portions, without dimpling, retraction, when you are pressing. Then you press the nipples and you see whether there's any discharge. You squeeze to see for any discharge. And also underarms, they should be smooth, and you should not have any swelling underneath your arms, which is called the axillary region. There should be no nodes palpable there. Then see, you can see the picture. This is a retracted nipple. This is important. And discharge, you see, it's particularly, the red discharge, the bloody discharge. This is not a good sign, There are a lot of discharges. There might be even milk discharging, in a non-lactating mother. But this bloody discharge, this typical picture is very important. These are rare signs which you have to be aware of. It's inflammatory breast cancer. It's an uncommon time where there's no lump. It's only the skin changes. The skin becomes thick, red, like, pitted, warm. So it's a rash-like look. So you may be just thinking, oh, it's just a rash in the breast. And you tend to ignore. No, it might be a sign of a different kind of cancer. So what is the general protocol? Whenever you get something suspicious, like, you'll go to the doctor. First thing, if you're below 30 years, an ultrasound will will give you more important information. If you're between 30 to 50 years, ultrasound plus a mammogram. And if you're more than 50 years, definitely mammogram and ultrasound. But if all these tests are not confirmatory, as we call equivocal, you're not getting any information, then obviously you have to do an MRI to rule out what is happening and to come to a correct diagnosis. Then once the diagnosis is done, obviously these things will be taken care of. You'll know where to go. You'll go to an oncosurgeon or cancer specialist who will take care of all this. Now, any idea, if you have, many of you might be having idea what's a probe. This is a patented bra and rope combination that is designed for women who have undergone breast surgery. They have already removed their breast, or they have some breast reconstructive surgery. This is a kind of garment which is very comfortable. Things in this robe where you have pockets, you can put up fluid for drainage. Post-operatively, patients can wear it very comfortable.
Indrani, just
Yeah.
one question there. You spoke about mammography. How often can you get a mammography done? Because is it harmful if you get it done every year?
No, it's recommended. After 35 years, it's annual.
Every year?
Okay. Every year.
Okay.
Yeah, after 35. So next we
Okay.
come to the preventive aspects. You all know that prevention is better than cure. No. So what is the most important thing which we have? It is the lifestyle modifications. What are the lifestyle modifications which we can do? So this year, the theme, as we said, choose to challenge. So we are going to choose to challenge that we are going to bring about some change today. It's better to change with time. So we're going to bring some changes and change in our lifestyle. We'll just do it. We have to pledge and we have to tell others. Spread this message to your near and dear ones. Exercise, which should be a part and parcel of your lifestyle. Either you do it alone, you do it with your partner, get it done, make it a part of your daily routine. Then relaxation, some me time, whatever you have, you work and all, you take out some time for yourself where you enjoy doing. You might be dancing, you like, you do. You might be enjoying music. These are all part and parcel of your healthy lifestyle. With so much of stress nowadays, this is very important. Then meditation, which will help you. Then most important, as I have already said, diet. The diet should be very healthy, all balanced. You can see colorful things. No, you just remember anything which is colorful, like, greens, red, orange, these are all good for your health. Colorful fruits and vegetables. Most important, weight reduction. Whatever if you have a good BMI, an ideal BMI, the risk of not only breast cancer, all sorts of cancer will be reduced. If you are this just I put this one, just if you're cycling or walking, you definitely, can save your money, save your pocket, and save your health also. And in the olden days, you see, kitchen, the people, women used to work a lot, and they used to keep their body weight like in control, so that their chances, they had less, very less those days. This disease also, all sorts of diseases were less. Then yes, this is the thing which is again have a high risk for breast cancer. So if you are into drinking, you have to stop alcohol. All sorts of physical activity must be there in your day-to-day life. Then breastfeeding, this is one of the very important thing which will reduce your breast cancer, after delivery, which is advocated 6 months of exclusive breastfeeding, and the next 2 years continue breastfeeding. Breast cancer will reduction, the risk of is cut, 50% if you have breastfed your child. And then any suspicious things, go to your regular health checkup to your doctor. Then the WHO says, there are ways you do not avoid any radiation. This is in general for all cancers. C means you have a sore which does not heal. If you have any unusual bleeding or discharge, it's any thickening or lump in breast, or for that matter, any part of your body, any indigestion or difficulty in swallowing, you're having some GI upsets and all, no, frequently, or you have some mole you have which is undergoing certain changes in that wart mole. And then if you have a nagging cough or hoarseness of voice, suddenly, these things which suddenly changes, which you're having a normal routine, if you're chronically constantly having it, no, we should like, so if we think that we can do it, we can fight it. Yes, we can fight it, So just I would like to end by this quote: this good physician treats the disease, the great physician treats the patient who has the disease. So breast cancer, it can be cured if diagnosed early. Please spread this message to your near and dear ones and you join the fight. And I'm sure we can all do it all together. Thank you so much for your patient hearing. And thank you all the people who have come here, have spared their valuable time to hear. Thank you so much. Hello, Rachna. I'm done
This
with
Thank you
my.
was
so much.
this was really informative, Indrani. Thank you so much. I think we often neglect a very important element and take life for granted. So this definitely was very informative, and I'm going to make sure that we do this test for. I do a mammo every year, but someone told me that we shouldn't do it every year. It causes radiation, so that was the reason why I had that question.
Because I said no, because the much more benefits of mammography are more than the small amount of radiation risk which you are getting. So
Yeah.
recommendations of 35 definitely annually.
So for young girls, what is the age to start? 20 years, you said.
Yeah, 20, there are, it's not that just because you will start your reproductive life after your childbearing. It's not young, as early as young girls can also have breast cancer. So that's why the
Yeah.
recommendations are from 20 years you start examining.
Great. Thank you.
It's so nice to see you, Savita.
Same year.
It's been long. So, Rachna,
Thank you so much, Savita ma'am, for your questions. And thank you so much, Indrani ma'am, for this wonderful
I
workshop
hope
and
I was
session
the
which you
time,
have conducted.
like the time I have, I'm sure I've not crossed my time.
No, 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 it's perfect.
Okay.
Okay, so now I would like to ask if someone has any questions to ask Dr. Indrani. Any
Should I
questions which you
stop
might
my
have in your
screen share?
mind?
Should I stop my screen share?
Yeah, you can do that.
Yeah.
Okay. So Indrani ma'am, we have got few questions which have come to
Yeah.
us before the session. So I
Yeah.
would like to ask them behalf of all our participants. So the first question goes like, do both the breasts differ in size in the late 30s, like one smaller and one bigger? And is this a normal thing to happen?
Okay. So, see, the breast development, it starts from puberty, right? Like, the changes in puberty. First initial changes in puberty, first is the breast development. That's we call thelarchy. Then comes the hair development. And then comes the menses, that is the menarche. So during puberty, there are a lot of hormonal changes which is occurring in your body. And for that matter, there might be some changes due to hormone that your one breast might become a little bit smaller than the other breast. So if it's from the beginning, there's nothing much to worry. It can happen, and there's no need to worry for that. Like, other than the cosmetic aspect, there's nothing much to worry if your one breast is smaller than the other. Can occur.
Okay, thank you. Thank you so much. I hope this answers our question. Next question which we have is why breasts become heavy before periods every month? And what can we do to stop it? Like, how can we prevent this?
See, this breast, and according to periods, it's the hormonal cycle in your menstrual cycles, no? Initial part, you are aware of the two main hormones in the female body, the estrogen and the progesterone. So initial part of the cycle, no, you start with estrogen, then the estrogen slowly rises, picks up, then you have ovulation, and then slowly the menstruation. So you have this in the initial beginning part of your cycle, the breast will be heavy. This is because of the effect of that hormone estrogen. So once the estrogen level comes down, you start menstruating, your heaviness goes up. This is absolutely normal. You don't need to do anything for that. No, if someone is really having this little bit of counseling, no medications required for your breast heaviness pre-periods, unless you're very symptomatic and very painful, then maybe some amount of, we have little medicines for that, analgesics and all, nothing great. It's mostly a reassurance, you get used to it every cycle. You have to remember one thing: the lesser medicines you take, it is better for your life. Okay, anything
Right,
which can be
correct.
solved without medicine is best.
Exactly. Yeah. Thank you so much for answering that question, Dr. Roy. Next question which we have is, anything to worry if there is a sudden pain in the breast, like if this pain happens suddenly or it goes unbearable sometime, but it goes away in due course of time. So is there anything to worry
Yes.
about that?
See, if you have a pain in your breast, first you need to see why the pain is occurring and is it related to the menstrual cycles. So many a time the pain might be, as said, no, the breasts are tender, lumpy, more premenstrually. So if the pain is very acute, that you, anything which is acute and which hampers in your day-to-day activity, then maybe you might need some treatment for that pain after ruling out whether it is a normal physiological pain or it's a pathological pain. But you have to see what is the cause of pain. Maybe you get your breast examined, or whether it's associated with discharge, menstrual cycle. And then if nothing as such, then simple analgesic medicines should help.
Thank you so much for answering that question. Next question we have got from a social activist and who work in the slums and all those rural areas of our country. So her question is, as a social activist, I see a lot of middle class women who don't go out or who cannot afford to go out for routine checkups. So in those cases, like how can they just look for some symptoms or signs and recognize it by themselves and take preventive care and measures?
So see, I have already told the self breast examination. This is, but more important is the awareness. It's more important you go to the periphery, the people who can't go out, raise some awareness campaign. Like go. I know it is very difficult. It's very easy to say that I'll do some awareness campaign, but to reach out to the people, to go and feel them, make them feel at home, because it is something, women, our Indian culture, that women, they'll everything every time, they're not, this breast is a nah, nah, nothing like that. That concept is there. We have to break this concept. So I think it is on us, we educated people, we go forward and bring out, counsel them that this is very important. You can do a self breast examination, teach them what is self breast. So anything like certain suspicious thing, then immediately they can report to the doctor. But they have to, we have to reach out to the crowd. So how we all take it. I've been having breast campaign awareness camps taking place here. I go out to the rural areas. Last year couldn't do anything because of this COVID, but every time we have a breastfeeding week celebration every year. So 1st of August to 7th of August, first week of August is dedicated to breast. So during those time we go out to the villages, we talk with the people, and then you tell them regarding certain signs and all. So we have to take this up. This is not a, this is a project which all of us can take. Educate the people, educate the masses.
Correct, that's right. So now the last question for the day we would like to go with. There are some institutions in Bangalore who treat breast cancer without undergoing surgery or chemotherapy. They use some magnetic therapy theory and follow that plan. Is this really effective? And can this type of treatment save a cancer patient from chemo, radiation, or surgery?
Okay, yes, if you're saying something like this, first thing, there are different types of breast cancer. Yeah, you have to do a confirmatory diagnosis and found there are different types of breast cancer. I mean to say the cells, the different cells which are respond, the cancerous cells. There are classification. Each cell is a different type which will manifest it differently. The progress of the disease will be different. Some will be very fast growing, some will be slow growing. So there are certain tumors or cancers which might respond to medical management. So maybe those sort of where the diet plan, you said some radiation, the latest new techniques, but all all will depend. There are certain surgeries, certain cancers with cell types where you have to go for surgery, and some where you might not go. There are some other modalities of treatment. So once you make a diagnosis, then the oncosurgeon will be able to give you the best form of management for that, which will be specific for that cancer, because I'm not a breast cancer specialist, So I think a breast cancer specialist will be able to answer it more nicely. But I feel that anything it should be specific to the type of cancer. The treatment is specific to the type of cancer.
Absolutely correct, ma'am. So with that, we come to an end of our questions and the session too. So I would like to just end this session with giving a huge thanks to Dr. Indrani for coming here and guiding us, telling us all the things and all the preventive measures which we need to know about breast cancer and how we can self-detect it. So thank you so much, Dr. Roy, and
Can I
thank you,
ask
CVMD.
something?
Yes,
Somebody
yes,
wants to
Purnima
ask
ma'am.
something.
Sure, sure. Please go ahead.
Can I ask something, Dr. G?
Yes, yes, yes. Please, G, please.
Dr. G, I had a niece, 55 years. I had at the age of 58, but she was breast cancer at the age of 55. And then she got the operation done. She was going through the chemo, whatever target therapy. And she was told that the cancer is spread to her body, eventually to her brain. So last 1 month before Diwali, she was totally on bed. So breast cancer, does it spread like that?
Yes, yes. Not for breast cancer, any cancer, no, there are stages of cancer. So once we call it metastasis, that means the secondaries, the breast, from anywhere the cancer may spread to any part of your body. So once it goes away from, if the primary is breast and it has gone to the brain, that means distant metastasis. So that is a stage 4 disease. That means the presentation of the disease is already stage 4. No, there are stage 1, stage 2, stage 3, stage 4. So even after stage 1, stage 2, we can still say early, where, like, 100%, sometimes even stage 100% cure it. But once it reaches stage 4, the things little get difficult, management
But
becomes
when
difficult. So if
but
it's
when she
spread
was
to the
at
brain,
stage 1, she went through that whatever the doctors told her. So
yeah,
what is the,
it,
like,
it,
you get just wonder that
yeah,
how
yeah.
can it spread when you are going through the treatment?
So when she was diagnosed, she was stage 1. Are you sure
I
she
think
was?
so.
So if
I
she is
think so.
already,
Because she
because
was moving out and all for almost a year.
you might be
Then that she
absolutely
lost the
normal.
hair and she lost the weight. She was quite healthy, but then during that
So the treatment was
period of
over
her
how many
treatment,
period? How many months period? Like, the, like, because if you're saying, like, brain, it's maybe the presentation was already stage 3, stage 4 when it was diagnosed. So whatever management was done was, must be because it has already spread to many.
and
It can spread.
can the breast cancer come at the age of 75 also? I wanted to ask, one of my relatives, she detected breast cancer at the age of 75. She was absolutely fine.
Yeah, yeah. It mutation of the cells can occur at any age. So it's not that if you are at one particular age, you will not have cancer. It might start as early as 20. Even many patients might get below 20 years also, and it might stretch up to as long as you're living. So it's not that, like, it will
But
come
it's
only
so
at that
scary. It is
active age.
so scary. It's very scary that you've lived all along healthy and then suddenly you're
So
detected
that
and then going through the operation and all. I
I can
just
understand
wonder
what
what is
goes.
happening to our bodies.
Yeah, yeah, I can understand what happens. I have myself, my mother has passed away due to cancer, and I know what is to have a cancer in a family. So it is very disheartening, but like, that's why this awareness, that if you can detect, but certain things, the presentation is late. The many other disease, they will not present you. You will not know anything when it is stage 1, stage 2, where it is curable. The disease will present to you in stage 4, where basically you don't have much to do. But then, whatever, how long you stay, it is
But
more important that the, like, you get the quality of life care during the time, the survival period, no, it is more important that the quality of life is maintained in that survival period. So that
But
is why the
it
early
is
detection
curable
is
at the
important.
age of 75 also. It's curable. It will get cured.
Yeah.
Oh,
Early stage, everything is
thank you
curable.
so much.
Early stage, everything is
Thank you
curable.
so much, doctor. Thank you. Thank you so much.
Thank you. Yes, Rachna, you have some queries?
Thank you so much, Pramila. So I think like if anybody else has any questions or anything regarding to breast cancer and any female hygiene, you can ask and go ahead and ask those also, or else we will be good to end our session.
Yeah, thank you so much for the lovely session, Dr. Indrani. It was really nice. Though many wanted to join, I don't know, probably afternoon hours
Because
or
I
lunchtime.
understood, like, because I'm not sure, like,
Everybody
how
is
much
busy with
benefit,
the
how much
women's celebration.
I could spread
Rachna,
the message.
everybody is busy with the women's celebration.
I
Oh,
think
maybe,
so.
yeah, everybody with the
I
Women's Day
think so.
celebration.
I
Yes,
think so.
honestly. And also that so many places this vaccination registrations are going on.
Going on, yeah.
So people are rushing there. All senior citizens are rushing there for the registration.
Okay, okay,
I
okay.
would be
Could
happy,
be
like,
one of the
more people would have come. I would have been
Yeah,
more
yeah.
happy. But
Actually,
anyway,
there are 19 people who had joined the group. I made a separate group to take a count, but then I don't know, few had joined us. But anyway, this will be posted in the group in our YouTube channels and everywhere. We'll be posting the discussion which we had today. Very nice discussion about the
I hope it
awareness.
will be
Yeah,
of benefit. I thought, like, let us do something which will help.
interactive, yeah, it should have been more interactive, but anyway, nevertheless, I think Professor Rachna had already sent us questions prior only, so that we don't waste our much time. And thank you. If you want to ask anything else,
well,
Professor Rachna, anything would you like to ask, especially to
share
doctor?
the number of doctors. So
Yes, surely,
share
surely.
the cell number of doctors. If anybody has the query, they can
Question,
directly ask
they
doctor.
can, okay, okay, surely. Rachna, would you like to ask anything, or then we can end, Ria, the session today with our vote of thanks?
I'm totally satisfied what she said, what she answered. Like, I'm already done with that. So there were only three queries which she answered. Thank you so much, doctor. We
Okay,
are
thank you.
really very thankful to you. It was very informative.
Thank you.
Yeah, to start the Women's Day, I thought this is the best way to start the Women's Day celebration with some health care and body related. So this was the way to start our Women's Day celebration from today onwards. So thank you very much, Dr. Indrani, for giving your valuable time to the ladies in our group, and it is
Thank you so
really
much for the
going to help them a
opportunity.
lot.
I want to
Thank
thank
you
you
so
for your
very
team.
much, Dr. Ji. Thank you,
Yeah.
Rachna. Thank you, Ria.
Thank you.
Thank
And
you,
Rachna,
Auntie.
thank
Thank you,
you for
Ria.
organizing this as well.
Yeah.
Because
you.
as you said, celebration, but this is the biggest celebration. Being healthy is the biggest celebration to my mind.
Yes,
So, Indrani,
correct, correct.
fabulous. This was such an informative session.
Thank you
Nice.
so
And
much.
Ria,
Thank you,
thank you to
Indrani.
you as well. Very well set up. So well done.
She's following her mother. Right.
Thank you so
Absolutely.
much for joining.
God bless her. She'll go great. She'll do great.
Yes, she'll go places. Yeah.
Thank you.
Lovely being with all of you all.
Thank you very much, all of you.
Same here.
Rachna,
Thank
Yeah,
you so
same here,
much.
same
we
here.
had two medical sessions today.
Yes, correct. Healthy, Amisha, and
Yes.
today with Dr. Indrani also just now. So thank you so much, all of you, for joining in the afternoon. And thank you, Doctor, very much once again. All of you will be meeting soon again with some more health issues
Sure.
related topics. Bye
Happy
for
Women's
now.
Day
Ria,
to
can
all.
we end it?
Happy
Happy
Women's Day.
Women's Day
Happy
to
Women's
all.
Day.
Happy Women's Day.
Healthy
Thank you.
Women Day.
Happy Women's Day. Thank you.
Thank
Yeah,
you.
thank you. Thank you.
Bye.
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 Bye.